Hello, welcome to OvarLive. I am Betty White, and I'm in my 20th year of survivorship from ovarian cancer, yay! And I am a member of the board of Ovarcome. Today I am joined by Dr. Shannon Westin to talk about ovarian cancer and clinical trials. Dr. Westin currently serves as the Director of Early Drug Development and Phase 1 trials at MD Anderson Cancer Center in Houston, and the principal investigator of multiple novel treatment trials for gynecologic cancers. As a survivor, I have questions about clinical trials, and I know that you do too. So let's get started. Dr. Westin.
Sounds like a plan.
What is the purpose of a clinical trial? And the second part being, what are the benefits in the short and long term?
Sure. Well, that's a very big question. So, the purposes of the clinical trial can be a number of things. The area that I'm most familiar with and the area that I kind of have the most experience in is looking at treatments, novel treatments, whether that be in the upfront setting when you first are diagnosed or in the recurrent setting when the cancer comes back. But in addition to that, there are also trials that touch on survivorship, so looking at ways to improve your quality of life after your cancer diagnosis. There can be trials about prevention, so for people that don't have a cancer diagnosis, how can they prevent cancer and how can that be applied across a number of populations. And then, of course, there can be just straight quality of life studies for patients with cancer, surgical studies to learn about new techniques. So there really are a number of amazing things that can come from clinical trials. But the reason that we have clinical trials is because we don't feel comfortable just starting something new, just giving a new therapy to somebody without doing it in a really organized fashion. Because it can be really hard if you just start giving something out to know what the effect really is. And ultimately, our number one goal is to cure cancer, but we also want to keep people safe. And so we don't want to put anybody at an increased risk. And so clinical trials have been slowly developed over time as the best way to evaluate a novel technique or a novel treatment or a novel quality of life intervention and determine, does it really have the effect we hope for, and is it safe? So as far as the second part of the question, you said risks and benefits?
Short-term,
short-term, long-term. So of course, the short-term benefits, as a clinical trialist myself and having seen family members go through cancer treatment, I can tell you that when you're on a clinical trial, you just get a little bit more monitoring. And typically you have a direct line to a nurse or a coordinator or somebody that's directly involved with the study. So that certainly is a nice short-term benefit. I feel like when my patients are on clinical trials, if they have any little thing, they know they can just give a call into the clinic. Now, we like to think our clinics are easy to contact no matter what, but there's something about having a direct phone line to somebody that can say, it's okay, what you're going through is normal, or hey, we need you to come on in. So I do think that's a short-term benefit. The long-term benefit, of course, is getting access to something you might not otherwise have. And great examples of this are some of the great novel therapies now that we have in ovarian cancer. If you think about PARP inhibitors, which are a treatment that has been FDA approved in a number of indications now, including recurrent BRCA mutant ovarian cancer, as well as all comers ovarian cancer for a maintenance setting, the patients that were on those trials, they got benefit earlier than everyone else before it got FDA approved. And so you potentially have access to a practice-changing and a life-changing therapy. Of course, there are no guarantees, and that's why it's research. So you can't know for sure that what you're going on is going to be your cure or is going to be the best opportunity for you. But certainly the long-term benefits can be seen if you get on the right trial.
Sure. Okay. What are the risks associated with clinical trials? Secondly, how could this impact my daily life in a positive or negative way?
Sure. I think there are a number of different risks that can be encountered with clinical trials, but the important thing to know is that every clinical trial has gone through very thorough investigation, and it's typically through something called an investigational or institutional review board. So these trials aren't just something that I, as an investigator, jot something down. I'm like, I think this is a good treatment, and we're going to go ahead and try it in a couple of patients. This has been thoroughly evaluated for science and for safety, and to make sure that when the trial finishes, the goals are going to be reached, so we're not wasting people's time. Of course, risks to any trial are that it may not work for you. So what your doctor will do is sit down and talk to you. Okay, what are the standard of care treatments potentially for you here? And what are the trial options? And so you can really sit and try to weigh, okay, what is the known benefit? What is my kind of guaranteed benefit, although that's a hard word, versus what's the potential, right? So the risk is that the trial intervention doesn't work as well. A lot of people worry about risks on clinical trials that they're not going to get the drug. So I think a lot of patients come to me and say, well, I don't want to go on a placebo, I don't want to be a guinea pig, that type of thing. But in reality, those types of trials are rare. Okay? Typically, most trials are going to include that you get that treatment. Okay? The only time we have a placebo or a no treatment arm is when no treatment exists. Right? So there's no known standard of care. And the standard of care would be to do nothing, to do surveillance or to be watched. So that's really the only time you're going to kind of get that placebo nowadays. Okay? Other risks are, of course, in early phase trials when we're trying new medications, we're learning about the toxicities, the side effects, the adverse events. And so sure, there's always a risk that you as a patient might have one of those side effects or those adverse events. But you can rest assured that the investigators and the institutional review boards and often the FDA, the Food and Drug Administration, have made sure that those risks are mitigated as much as possible, to reduce those risks as much as possible. But with any clinical trial, there's going to be some amount of risk. As far as long-term, I think the majority of the long-term risk is low. But every once in a while, there are going to be side effects that do last long-term. But it can be hard to predict those types of things.
Okay. How do I determine the best clinical trial for me? Secondly, why is it so difficult to search for clinical trials? And how could it be made easier?
Oh, wow, that's a loaded question. So I'll start with the easy part of that question. How do you pick the right clinical trial for you? I think that you have to have an open communication with your physician. I think that certainly they're the ones that can really look at your whole case and determine what might be right for you. With that being said, certainly at MD Anderson, we have quite a few clinical trials at any given time point. But in other institutions, it may not be as as easy to get those same clinical trials at your institution. And so then you need to ask your doctor, hi, I understand this is the standard of care you're giving me, but are there any clinical trials that might make sense for me? And hopefully they know, but if not, then you guys can work together to try to find those things. If you're at an institution that has a number of clinical trials, then you sit down and look at stuff called eligibility criteria. And that is saying, okay, what's the cancer type that's included? What's the phase of treatment? What are the medical conditions that are not allowed? For example, with immune therapy, there are certain inflammatory conditions that we just can't let go on trial because they could get really sick, right? So there's going to be a series of, I always tell my patients, hoops that you need to jump through. Not literally, although sometimes it feels like that. But generally looking to see, are you eligible? Is this safe? Is this the right option for you? And then ultimately you sit down and weigh what your potential benefits are, what are the risks, and also what's the logistics, right? So some trials you only have to come once every 3 or 4 weeks. Some trials you have to come every week, sometimes more than that. Some trials you have to get biopsies or lots of labs, and so you have to decide kind of what are you willing to go through, what are the positives that could come out of that trial, and ultimately come down to a choice. But it's tough. It can be really tough, especially when there's a lot of stuff out there. As far as why it's so hard to find a clinical trial, this is a great thing. I am part of the communications committee of the Society of GYN Oncology, and this is something we're working on right now because there's a huge issue with the number of clinical trials that are out there for GYN cancer. They're falling down quite low. But also our ability to get patients plugged in with the right trials. And so, there are a number of different search engines, but they're not exactly the most patient-friendly. So, the NCI, the National Cancer Institute, has one. There are some through the American Cancer Society. There are institutionally based ones, like MD Anderson has a GYN oriented clinical trial search, but if you don't know where to look, it can be kind of hard to find. And so as part of this year's kind of goals in the Society of GYN Oncology, we're trying to create a more user-friendly search where you can say, I have ovarian cancer, this is the stage of my disease, this is where I'm at, and it'll help start pulling in trials for you. So it's a work in progress, and we will be reaching out to survivors like yourself to really help us figure out the best things to have in that, and to try to make it as easy as possible. But you're right, it's a huge challenge.
All right, perfect. What will my health insurance cover? What if I don't have health insurance? Who could I talk to from my insurance company or healthcare provider about my questions?
Okay, sure. So remember I talked to you about the hoops for clinical trials.
Right.
One hoop we always talk about is the insurance hoop. So we always want to make sure that your insurance company, your Medicare, Medicaid is going to cover. But I will tell you, there's a couple of points here that are important. One is the majority of insurance companies now will cover clinical trials. It's been something that was pushed forward by the Affordable Care Act. It was one of the provisions, and I personally, as an investigator, have seen that the number of approvals has gone up markedly, or conversely, the number of people that are not allowed on trial because they don't have coverage is much lower.
Oh.
With that being said, we always want to make sure that the patient is not going to have to be charged. In general, for the bulk of trials, the insurance company is not going to have to pay for much. It's going to be covered by the trial, especially for novel therapies, new drugs that require specific testing. All of those things that are specific to the trial are going to be paid for by the trial. The things that your insurance company or that you as the patient will have to cover are going to be the standard things. So a visit with the doctor that you would have anyway, labs that you would have anyway, imaging or CT scans that you would have anyway. So what we're going to do is, before you start that trial, we're going to tell your insurance company, okay, this is what we have planned, this is the clinical trial, and these are the things that are research, and these are the things that are standard. And they'll say, okay, yes, we allow our patients to go on clinical trial. So that's and that happens automatically. Most centers are going to have a financial group that when I as a physician say, okay, this is the treatment plan we're pursuing, they'll say, okay, we'll check with the insurance company. For patients that don't have insurance, it's going to be a little different. Some institutions have support for those patients. Certainly we would encourage those patients to reach out and see if they qualify for the marketplace under the Affordable Care Act, because that is a great way to get coverage. Or they're going to have to pay out of pocket. And so what our financial group will help you with is, what does that going to cost? A lot of times it will be the same as standard, right? Because all of those things I just mentioned that you would be responsible for are the things you'd be responsible for coming for your usual treatments. And so that would be something that you would discuss with the financial counselor at the institution where you are going to get your treatment. And then as far as finding out if you have coverage, you can call the coverage specialist in your insurance company or whoever's giving you coverage, and they should be able to help you understand what you're covered for and any other questions you might have in that
Okay.
regard.
Good. What would my responsibility be if I participated in this clinical trial?
You got to show up when we tell you. No.
I've heard that.
Honestly, though, being a part of a clinical trial, what you'll do is, before you sign informed consent is where you hear all about the potential benefits, the risks, and all the stuff that you're expected to do. It will be laid out very clearly for you. So a lot of it's going to depend on the type of trial. So as we talked about, early phase trials are going to be potentially a little busier, a little bit more labs, a little bit more visits with the doctor, a little bit more kind of close contact, calling immediately when there's a problem. But all that is going to be laid out for you before you sign and say, I'm going to do this. But one of the things we talk about is, once you sign the consent, we expect you kind of to follow all the rules, so don't take a medication unless you check with the nurse to make sure it's safe, Don't just deal with a side effect and don't call. Don't struggle at home and think, well, I'll be okay. We want you to check in with us, and then show up when you're supposed to show up. So if you have an appointment, come on in and let's get it done. And of course, if there's a problem, you just let us know. So really, your responsibility is to just kind of follow the rules and do your best to do that. With that being said, whenever you sign an informed consent and say, I'm going to go on a clinical trial and this is what I'm going to do, you can always change your mind. This is not a binding contract. Of course, we would expect when you sign informed consent that you're ready to do this and you're going to do this, because you're taking a spot and certainly other people might want it. But with that being said, if things aren't going the way you want them to, or you're not feeling well enough, or it's just not working out for the family, or whatever the reason, it doesn't matter. You can always say, I don't want to do this anymore. But I would just encourage you, if you're considering clinical trials, to really think it through, because that's hard, right? That's a lot of work for you. That's a lot of work for the study team, and certainly we don't want to take your time away from another treatment. And so if you're on a trial and then you kind of move out in the middle, it'd be tough for a transition to a new therapy. So, ultimately I think we as investigators and caregivers for patients just want you guys to be as safe as possible. And so that's why all those rules are in place, and that's kind of why that structure is there.
All right. I think that concludes my list of questions, Dr. Westin. We'll see if any have come in.
I think that, certainly this is a talk about ovarian cancer, but, clinical trials can be done for, any number of cancer types. And I think that the National Cancer Institute does a really good job of trying to kind of provide that information for patients. I would say that if you are, interested in a clinical trial, reach out to your physician, reach out to, we have patient navigators and research navigators at MD Anderson that can help you, and we're certainly happy to take those calls and make sure we can get you connected to the right trial for you.
Hello everyone, I'm Ransi. I'm the founder of Ovarcome. I'm with Shannon and Betty, our board member today. We are going to do something fun. So we had a Kendra Scott fundraiser last week, and so we had many of you support us. So thank you. And we're going to pick one winner who wins one of our Teal Talk Day t-shirts and a pair of Kendra Scott earrings. So we will,
very pretty.
we will let Dr. Westin
pick the name for me. Okay, let's see. I'm going to pick not that one, okay. All right, let's see. Patty Scott.
Yay! If you're watching, then great. If not, we will get in touch with you.
If not, I'll just take it for you. No problem.
And we will get the t-shirt and the earrings out to you. So before we end, I would like both of you to hold this, and also me to hold this, and say, talk about ovarian cancer. Together, we can overcome. Thank you.
Thank you.
Thank you.